it on? Okay, I'm out of there. Have a good one. Sunday morning, man. Long night work. Headed home to Jody and some home-cooked breakfast. I can't wait. What we represent, man?
Big money bound.
So let her know, man.
Big money bound.
The kids, man. We got the kids, man. Big Money Bound TV, RRT Posse, YouTube. If you're new to the channel, please like, subscribe, and turn on post notifications. I release scheduled videos every Monday, 12 o'clock a.m. Eastern Time. But I also release some unscheduled videos throughout the week. Now, if you're returning, welcome back. I appreciate all of the support. Thank you. Last night, they had me down in the ER. I said I worked ER probably twice in the last 2 months. So I was down in the ER last night, man. My night started off with some confusion. That's why it's key as a student, even as a therapist. You can't be afraid to talk to these doctors and follow up with the orders. The physicians sometimes make mistakes as well. I get an order for a high flow nasal cannula. I'm like, man, we don't really use the high flow nasal cannula in the ER, but we have used it before, but it's not something that we do often. It's rare. I'm like, all right, man, let me go ahead and take a look at the patient and see what's going on, man. I go in there, the patient on 2 liters, sat 100%. I'm like, yeah, dog probably tripping. I ain't gonna even pay no attention to that. Then the nurse like, oh, you can go check with the doctor. He's right over there. He's right over there. I'm like, all right, let me holler at dude. Since he's right there, I'll go holler at him. I'm like, hey, man, did you want to put this patient on a high flow nasal cannula? Oh, no, that was a mistake. I tried to put in nasal cannula for the order. It's okay. I put in nasal cannula. All right, dog. That's no problem. I'm glad I found you, because I wasn't just put nobody on a high flow nasal cannula who didn't need it. Same patient, man. They was like, yeah, did he order a blood gas? We having trouble, like, getting the venous blood. It's commonplace for, like, if it's a difficult patient to stick, they'll call respiratory therapy to do like a arterial lab draw. You'll just get the arterial blood and run the same labs that you would run through the venous blood, or most of the labs. But it's something that, it's a protocol, you know, like they gotta try a few times, and the lab gotta try a few times, the doctor gotta try a few times, then respiratory therapy. You feel me? Because you got ER work, and then you got blood drawing work. That's just a lot of stuff empowered on one person, so it's a protocol. So I'm like, hey, man, if y'all couldn't get it, man, y'all gotta call the professionals. If y'all couldn't get it, nurse got hot. We are professionals. Hey, no, hey, but I wasn't trying to get like disrespectful to you. I'm just saying, bro, like, you want to call the professionals who all they do is draw blood, which is the phlebotomist. That's who the best in the hospital. That's all they do. That's their job, drawing blood. So if you can't get it, bro, call a professional. I ain't trying to throw no shade at you, bro. Like, you good? But I guess it's all about perception, how you can perceive things. You feel me? With the COVID-19 situation, y'all know they stopped doing a lot of like surgical procedures in the hospital. They stopped a lot of outpatients coming in. They stopped a lot of stuff was stopped being done at the hospital. So the hospital lost a lot of money. So it was time to get our yearly raise. Our yearly raise was due in like July. They say, no, we ain't doing no raises this year. What's happening? They saying, yeah, you know, things are slow. When they come back, we can do this. We'll try to give it to you. They taking it as things are slow. How I perceived it is, you ain't getting no money, and what you gonna do about it? This is our corporation, and what we say goes. That's how I perceived it. That ain't what they said. That's how I took it. You count on this raise to happen every year. We may not want to give you one next year. I know what we've been doing, but this year I may feel a little different about you. Bro, you gotta. That just showed me, like, you gotta set up other things. Gotta be set up. You feel me? Other ventures gotta be in place. You feel me? That's what that showed me. Right? They slapped me upside the head. I was counting that raise. I needed my 15 cents, though. I needed all 15 of mine, man. Hey, bro, I needed my 15%. Then just so happened, my dog tell me You heard about the bonus that we getting? No, what bonus, dog? What bonus you talking about? Now they saying they finna give us our raise and some bonus money on top of that. But they gonna do that. They gonna do that in October. Why I can't get that now in September, though? Why I gotta wait till October? No October date, just October. That could be October 31st, Halloween. Come on, man, trick or treat. Like, I want to get my money today. But hey, I can't be upset knowing I'm finna get my money, dog. That was a nice little surprise, you feel me? That was right on time. Speaking of being right on time, one respiratory therapist is covering 100+ bed ER. How they doing this? I don't know. Like I told y'all, I got one speed, so I can do what I can do. I'm over here in this code. I can get over there to that code. You feel me? I'm only human. I know y'all seen the videos. One respiratory therapist, 3 code blues. What you want me to do? You feel me? 3 code blues. What you want me to do? So they got a patient who's ready to go up to their room. It's a ventilated patient. So the patient got a bedroom. They need respiratory therapy to transport the patient on a transport vent, follow behind to make sure nothing goes wrong. That's cool. I can do that. I done that numerous amounts of time. I'm a seasoned respiratory therapist, but I still have room to grow and I still can learn some things. You feel me? You gotta always be open to learn. So I'm gonna get there. But before I can get there, they keep putting in stat ABGs, stat ABGs, stat ABGs. You got a patient, we know their status. They just waiting to go up. Now you got somebody who need a stat ABG, we don't know what the hell going on with them. What should I do first? I'm gonna wait. What should I do first, though? Y'all tell me what should I do first, man, while I brush my chin. I'm gonna brush my chin. What should I do first, though? Should I do the stat ABGs? Or should I take the patient up who ventilated already? We know what's going on with? Y'all let me know, please, though. Because I'm human, baby. I make mistakes. Of course. So I'm doing these ABGs. I got blood in my hand. I got like blood in my hand. Bro, I'm getting my hands bloody out here. It's blood in my hands. ABG kits, I got the blood in my hands. Sure, they're gonna ask me. The nurse gonna ask me, are you gonna take this patient out with me? Hey, bro, hey. I can take the patient out with you, but bro, I'm running blood gases, bro. Like, you gotta chill. Okay, I'm just asking. Yeah, like, and I don't ever want to come off as like rude or like mean or anything like that to anyone, especially not like a female. But dog, you see I got blood in my hands. I'm going to run blood gases. Don't ask me what am I ready to go up, bro. I got blood in my... It's over, dog. I made it through that, you feel me? I made it through. Ran my blood gases. Taking the patient on up. Before we go up, we gotta go to MRI. Alright, that's a little different. I never took nobody from no ER to no MRI. But whatever. Like I said, I'm a seasoned respiratory therapist. Let's do it, dog. So we get in there. Before you go into the MRI machine, you gotta take off like 35, 45 different things. Everything out your pocket, everything off your ears. Make sure you ain't got your credit cards in your pockets. You ain't got your cell phone, your job phone, your badge on. Because that metal finna yank everything into that machine, bro. So that take a little bit of time. Then they gotta get pumps and tools over. That takes some time. They gotta get electrodes and devices. That take a little time. So I'm in there like, hey, dog, how much oxygen left in that tank, man? We gotta hurry up. It's an E-cylinder tank. 100% oxygen, you feel me? And it's a formula for that E-tank when being ran at like a certain liter flow. So let's say it's at 25 liters per minute in the E-cylinder. How many hours would that last or whatever? Hey, I forgot that formula because I rarely need it. You feel me? But now I did, and I didn't know it. You feel me? So I'm checking the tank. Tank almost empty, you know. I'm like, hey, man, we gotta get this patient set. We gotta get the patient hooked up to the wall O2. Let's hurry up now. Let's hurry up. We playing around. I gotta do this. I gotta do that. I gotta do this. I gotta do that. Okay, cool. That tank getting lower and lower. It's getting dangerously low. I'm like, okay. hey, man, I don't care. Hey, I see what y'all doing. But the most important thing that we got to do is get this vent on oxygen, man. Without oxygen, we in trouble, man. We can't get oxygen to the vital organs. They're like, come on, man, we know that. Hey, act like you know that, dog. Hook it up, man. I got to hook this thing up. So we finally hooked it up. We got it to, because it's like a safety line that you can't pass. And I wasn't finna pass that line if I still had my phone in my pocket. I still had anybody who work overnight, dog, you already know. You gotta have your charge on you, feel me? I had my charge in my pocket. I had a few coins and pennies. I wasn't finna get snatched inside the machine, so I'm standing behind the line. They hooking the device up to the wall. You know, I was finna say it's women. I'm not gonna say that. It was a smaller lady, you feel me? So you gotta have some force to put it inside. She was having some trouble, but I was encouraging her, and finally she got it. But now the vent, the portable vent, it's on 50% FiO2 because I had put it down since the tank was running low. You feel me? So I put it to 50. The patient was originally on 50, but you do 100 for transport. That's just protocol. But I went down to 50 to preserve the tank. So I'm like, hey, can you touch the transport vent and turn the FiO2 up to 100%? They're like, where is it? I'm like, bro, it's the button right there beneath this button. It's below that button. Bro, they had a hard time getting to the button, but I couldn't cross that line because, hey, dog, I got all this stuff, man. Hey, I want to help, but I can't help. You feel me? MRIs, that took like 2 hours, dog. So, of course, I had to go back and cover the ER. So they called me. Then, like I'm saying again, like, I'm not trying to be disrespectful to nobody. They called me saying, I think they're ready in MRI. I think they're ready. Somebody called me from ER saying they think they're ready in MRI. I'm like, are they ready? Or like, you think they're ready? Like, am I wrong? Please drop in the comments. Am I wrong? Like, I think they're ready. Like, bro, they saying, are they ready or not? Like, well, they told me they'll be ready in 30 minutes. That was 30 minutes ago. So I see how you responding, bro, that you kind of angry. Like I said, again, this is a woman. It's a lady, you feel me? The hospital full of women, like, especially nurses. It's a lady. So I'm like, all right. I think I'll be there in 10 minutes. Hey, Jody Joe say I'm the king of petty, dog. I'm the king of being petty, man. But hey, drop in the comments. Was I wrong? Like, bro, are they ready or are they not ready? So that was my night in a nutshell, man. Then it's like, they got people coming. Communication is key, dog. I understand, like, it may not help the nurse with her job, but it's gonna help me with my job. A patient coming in, respiratory distress, comes to this room. Come to this room and bring what? A vent? A BiPAP? They intubated? Like, bro, let me know. Oh, I don't know, they ain't tell me all that. Y'all have a good one, dog. Bro, shout out to the nurses, man. That's doing the proper job. Like, bro, you can't tell me somebody in there, I don't know. They say call respiratory. Call me and do what? This shit is, excuse my language, man, but this is serious, bro. Like, we in the ER, dog. I get the patient need BiPAP, bro. I gotta go bring a BiPAP, dog. All right, RC Posse, I got us, man. I'm gonna go home and have me some breakfast, dog. I'm hungry, man. Jody Joe, I'm on the way, baby. Jody Joe, I'm on the way, baby. Please feed me, baby. Please feed me.